Experts say a new study shows that people who are obese and get COVID can have much worse outcomes. The study from the CDC found that more than 70,000 hospitalized COVID patients from March to December were obese. Nearly 51%, 28% were overweight. Dr. Ethan Lazarus is the president of the Obesity Medicine Association. They train medical providers on how to treat obesity.
Statistically, people at a high body mass index unfortunately, we're disproportionately being injured by this pandemic.
The CDC report showed that obesity is a risk factor for both hospitalization and death.
People who have morbid obesity have respiratory complications just because of the weight that's on the chest. It's more difficult to breathe because of the weight that pushes on the stomach, so it's harder to get a deep breath. So it's not surprising that they would have a more difficult time with a respiratory disease.
Obesity was a major problem even before COVID.
You know, obesity is a medical disease like diabetes or hypertension or even depression. And telling a person with obesity to eat less and that'll cure the problem, that works about as well as telling a person with depression to think happy thoughts.
This doctor says the stigma about obesity needs to change.
One of the things I think COVID has done is it's really pushed us to recognize this actually is a medical problem, and it is a deadly medical problem, and it's deserving of treatment and the same level of respect and seriousness as any other medical problem.
This study shows new concerns.
A lot of people think because they're 30 or 40 that they're not really high risk for COVID. But this study highlights that younger people with obesity are in fact really high risk for COVID.
In Virginia, people considered obese can now get vaccinated.
Stay safe and get immunized. I think this, if anything, this study highlights the importance of those two things immediately.
I'm Margaret Cavanaugh for News 3.